Thanks so much, Kate, and thanks, Laura, for getting the slides up. I always find it a bit peculiar when someone else is in control of my slides. That's probably because I like to have control of everything. I'm so delighted to be here and so delighted to see so many of you here. And before I kick off, I just wanted to say it's Thursday morning. We're all in lockdown. We've probably a lot of us have got kids ramming around and dogs and cats and whatever else and all of our stresses and going on. And yet here we are talking about trauma in the justice system. And I just wanted to highlight right at the beginning that look after yourself. Do what you need to do to make this okay and manageable for you. You know, I've got my cup of tea. It's a little warming, grounding object. I used to have a hot water bottle by my feet. I've given that one up. But just permission to do what you need to do to manage talking about trauma, particularly when you're in your own home. So my name is Caroline Bruce and I'm Head of Programme for Trauma here at NHS Education for Scotland. And what that means is I've got kind of a lot of operational responsibility within the National Trauma Training Programme. And I just wanted to highlight before we kick off as well that there's a hashtag for this event and it's hashtag Trauma Deep Dive, I think. Somebody keep me right if that's wrong. And just if for those of you who are tweeters, I am definitely not, then please do tweet and feel free to tweet any of the slides or anything that any of the speakers today are saying. So next slide, please, Laura. I'm here to speak about two different things. I'm going to take about 15 minutes, I think. I was going to take about 20, but I'm going to gallop it down into 15 minutes, I hope.
Thank you, Dana.
The first half will be about the National Trauma Training Programme and generally kind of where it's sitting and what is it and why is it doing what it's doing. And the second half will be particularly around the victims and some of the victims and witnesses work that we're taking forward with the Victims and Witnesses Task Force. I'm really delighted to see Kate here today, who's one of the driving forces there. So I suppose I wanted to kick off with why do we have a National Trauma Training Programme? And I think it's in recognition, you know, particularly with, you know, greater recognition with the ACEs literature, but kind of across the board that trauma is, the prevalence of trauma and our experience of trauma and adversity is much greater than we maybe initially recognised 10 or 15 years ago. And also the depth and breadth of the impact that it has on us as humans is much broader than we might first think. So this is a bit of a busy slide, but on the right-hand side, you see this tree. And what it's telling you is that as trauma and adversity kind of, it feeds into our roots and we are the growing trees, not only does it have an impact on our mental health, but it also has an impact significantly on our physical health. We've got much greater probability of having non-communicable diseases like heart disease and diabetes and stroke if we've experienced trauma and adversity. But it also has a really significant impact on social outcomes like access to education, contact with the justice system. So we know that if you experience 4 or more ACEs, you're both much more likely to be a victim of offences later on in your life, and you're more likely to be a perpetrator of offences and end up in prison if you've experienced significant amounts of adversity and trauma. And there's relationship risks in terms of domestic abuse and other types of relationship risks, and there's reduced opportunities in housing, in across the board in terms of employment. And so we know that unless we have a system in place nationally that says that trauma is everybody's business, whether you're working in justice, whether you're working in housing, whether you're working as a teacher, if we don't understand the impact of trauma and we're there to be able to mitigate that impact and support people to access the resources we're gatekeepers to effectively, then we will perpetrate and maintain these what I would call inequalities relating to the impact of trauma and adversity. So next slide, please. And this is just a little bit of a word about language, that a lot of us will have heard of the adverse childhood experiences studies, but that there's a huge overlap between what we call adverse childhood experiences, trauma, complex trauma, and single incident trauma. So what we mean by single incident trauma is one that happens one-off, a car accident or a robbery or a rape. Complex trauma is where that's repeated in domestic abuse, in some war trauma, in sexual abuse. And those all come under that lip of trauma. And I think it's important that on the one hand that we're not too precious about the language that we use, but on the other hand, we are very clear about it. You know, and sometimes we'll say casually, God, I had a traumatic morning, I broke my phone. And we're sort of in a way degrading the meaning of the word trauma. So what we mean by the word trauma and by adversity is really important. Next click, please. And I think on top of that, as Kate has so helpfully said, that the impact of COVID-19, both as a bringer of trauma in and of itself, so it brings what we call threat to ourselves, a sense of threat to ourselves, but also a threat to our loved ones directly in terms of catching it and the significant consequences that that can bring, but also indirectly in terms of it separating us from our buffers. If we've already experienced trauma, then we know that the most important things we need to be able to recover from the impact of trauma and adversity are our social connections in our community and with our nearest and dearest. And social distancing from the impact of COVID-19 means that we don't have access to those buffers. And on top of that, without those protective factors, as Kate has already indicated, we're much more likely to be exposed to things like domestic abuse, to childhood sexual abuse, and those risks are increasing. And so we need to think about COVID both as a primary perpetrator of traumatic events, but also as a way of distancing ourselves from our recovery supports. Next slide, please. And so I suppose it's important to say, what do we mean by a trauma-informed nation? And we talk about the 4 Rs, and we've added in a couple of our own, kind of because we think that they're really critical and important ones. But those 4 Rs are realising the prevalence of trauma, that everybody knows that trauma is really quite common. And we recognise the impact of trauma, especially in terms of the barriers that can relate to accessing life chances, not just in mental health, but how does it stop us from accessing a dentist? How might the experience of trauma stop us from accessing education, from employment? And we respond. Everybody knows how to respond with that recognition in mind, so that we do no harm, we don't re-traumatise, we support people's recovery, and we create systems that remove the potential trauma-related barriers to accessing all those life chances. And that we also recognise that the experience of trauma and adversity develops people's strengths. It doesn't break people's strengths, it develops certain strengths in people that we need to recognise and support them to use. And that relationships matter, and that spelling error is important there. Relationships, that's about having relationships that are human, that recognise all those things, but that also is human to human. Next click, please. And so re-traumatisation is really critical here. We hear the word re-traumatisation an awful lot, but what does that actually mean? And it means that we know that trauma most often happens in relationships, and those relationships are characterised by key features. Traumatic relationships, the ones that happen in domestic abuse or in childhood sexual abuse, or in anything in which trauma happens, in which a relationship is present, often that relationship doesn't feel safe. You don't have a sense of choice or control over what happens, that trust is breached. And those are the elements of relationships that are traumatizing. And so the opposite of that is what we call a trauma-informed relationship: safety, choice, collaboration, empowerment, and trust. If we offer those things throughout all of our relationships, whether it be in the justice system or elsewhere, we know that we are not re-traumatizing in the course of the process of our relationship. Next slide, please. And so the vision of the Scottish Government is a trauma-informed and responsive nation and workforce that's capable of recognising where people are affected by trauma and adversity, that's able to respond in ways that prevent further harm and support recovery, and can address inequalities and improve life chances. And we see from the pledges that are starting to come in, that will be launched shortly from local authorities and our partners in terms of champions and on the steering group, that there are lots of organisations who are pledging to maintain this as an aim for the nation. Next click, please. And the National Trauma Training Programme, we are aiming to support that by, and this is a bit of a wordy quote, I'll probably change it sometime down the line, create and disseminate educational and training tools and resources that can enable organisations and individuals to create a trauma-informed and responsive workforce to support that vision. Next click, please. And what that means is we've got these two drivers. On the left-hand side, you'll see a real backbone to the National Trauma Training Programme, and that's our Transforming Psychological Trauma Knowledge and Skills framework. This is really about what does every single member of the workforce need to know and be able to do to be able to support that aim. And I'll come to that in a minute. On the right-hand side, you've got the Scottish Psychological Trauma Training Plan. So how are we actually going to implement that? How do we support organisations to train their staff in those knowledge and skills, and then to support them to be able to use those skills in practice to achieve that aim? And one of the things I want to say is that whilst the National Trauma Training Programme, I'm going to introduce you to them in a minute, have developed a whole range of really good freely accessible training resources, we're not the only show in town. There's lots of organisations in small level and large level delivering really good training to the Transforming Psychological Knowledge and Skills framework. And the Trauma Training Plan is how you identify good trauma training for your organisation. Next click, please. And so when we think about who needs to know what and when, this is a bit of a busy slide that I apologise for, not everybody needs to be a trauma expert. In fact, very few of us need to be trauma experts. And so when we think about the trauma-informed and trauma-skilled levels, if you look on the left-hand side here, these are people who don't have an explicit role in the recovery of people who are affected by trauma. And what do those people need to know and do at the trauma-informed skill level? You need to understand how the impact of trauma might affect people's responses to you and your organisation. So if you're a dentist, how might trauma affect somebody's ability to come to the dentist, and how do I adapt what I do? And that's the second part. How do I adapt how I work so you don't do any further harm, so you don't re-traumatize? Those principles of choice, control, collaboration, trust, and safety. And how do we make sure that the impact of trauma doesn't create a barrier? So how do I adapt how I work as a dentist to allow somebody to be able to access that, even though they may have experienced trauma?
So you want
and then at the trauma specialist and trauma enhanced level, we're thinking about people who really do have an explicit role in supporting children or adults affected by trauma to recover. And that includes perhaps people who are working in homelessness, because having a home and a safe place is part of recovery, as well as psychological recovery. And that's offer evidence-based approaches to recognising resilience and supporting recovery, and taking that into account when you're doing your job that is part of supporting recovery. Next slide, please. And how do we implement it? I'm not going to say very much about this slide at all because I'm aware of time, but what you will have is a PDF that you can link to at the end of this session today, which really summarises all of the different resources that we have. The one that I wanted to highlight is probably the Trauma Skill D module. It's called Developing Your Trauma Skill Practice, and it's the backbone of really our educational resources that are freely available. And the other one I'd highlight is Opening Doors and Sowing Seeds, are 2 animations, and we're releasing 2 workshops that go alongside those that in your organisation you can use to think about how do we embed those key principles in practice. Next slide, please. And the last thing I wanted to say from a general perspective is that knowledge and skills right in the middle, they are only one element of a trauma-informed workforce. We also know that workforce well-being and supporting that as an organisation are really critical. You can't pour from an empty cup, so we can't expect our members of staff to be able to deliver and implement those new knowledge and skills without being well and supported themselves. And we know that it's not them and us. Many members of our workforce have their own experiences of trauma. And that takes leadership and organisational support to be able to implement that in practice. And on the right-hand side, we have to make sure that our systems, our policies, our practices are informed and in collaboration with people with lived experience of trauma, that there's a real genuine shared power with people with lived experience of trauma, because only they can tell us what they need from a trauma-informed system. There's no such thing as a trauma-informed organisation that isn't informed by people affected by trauma. Next slide, please. So thinking about trauma-informed justice for victims and witnesses, it's the same things that we talked about earlier, but all of those factors that Kate referred to in terms of the potential for re-traumatization, needing to retell your story, the impact of trauma on people's memories, and the physical potentially components of the impact of trauma in terms of getting physical evidence, for example, victims of rape and sexual assault when they have a forensic medical examination, that we're thinking about, particularly in a justice system for victims and witnesses. How do we realise the prevalence of trauma there and recognise the impact, especially in relation to credibility and credibility and evidence? And one of the things that Kate highlighted was that quote that sometimes people say engaging with the justice system actually is worse than the trauma itself. Next click, please. And that's really thinking about re-traumatization. And a justice system that's trauma-informed understands that unless we do the opposite of what traumatizing relationships do, that we offer choice, next click please, choice, control, collaboration, trust and safety, we risk bringing back those powerful memories and those powerful feelings that happened in the traumatic event itself, the offence that was committed against the victims and witnesses. And when we trigger that with a lack of safety, a lack of choice, a lack of corroboration, not only are we making people feel that they're unsafe, but we're also bringing back all of those feelings that happened at the time when the event, the traumatic event was happening. And that's where people start to say, this felt as bad as the event itself. Next clip, please. I think it's really important, if I do nothing else today, to say why this is important. And the message, I think, from Kate, and definitely from myself as well, is if we want to make this trauma-informed, we have to hear directly from the people who are involved, the victims and witnesses who are in the system, and also the members of staff who are supporting them. So I've done 3 pieces of research so far. One with senior clinicians who've worked with, each of them have worked with over 100 victims, in this case, of childhood sexual abuse. And the vast majority, you can see from these quotes, they tell us that the vast majority of my clients haven't engaged in the legal system. I'd say there's far more people who don't do anything than do. Next slide, please. And why is that? And this is just one of the quotes that came out of that research with these experts. I think they find the legal system very intimidating. They're afraid that they won't understand it, they won't be supported, they're not given any information, that police will come and interview them and they don't hear from them, they don't know what's going to happen with that information, then they can't take it back, they don't have any power, they don't have any control, they feel that they don't have any power over that, and that their safety can be compromised. So you can see that those key themes, if you don't have a sense of safety, a sense of control, a sense of knowing what's going to happen and when, those key trauma-informed principles, that can really re-traumatize people and actually stop people from coming forward in the first place to report some of the most fundamentally brutalizing experiences and crimes against us as human beings. Next slide, please. And this is what we were told by adult survivors of childhood sexual abuse. I don't know, and this is another piece of research that we did with survivors themselves, and this is what somebody said, this is what Jess said. I don't know how I could possibly ever manage all the different steps in it without giving up and going, that's too much, and ending up in hospital. I don't see me being able to get through to the other end of it. Next clip, please.
Caroline, just a reminder of time.
I know, I'm going to take 2 extra minutes if that's okay. It's going to be worse than 20 grenades getting the pins wheeked out, thrown out, and kaboom. And I'm going to be right in the middle of all that. So this is what we need to listen to. We need to listen to what people are expecting from the Justice Service, because this is what they come with. Next slide, please. And I think, and this comes from people who support, so rape crisis and VIA support officers within the system supporting victims of sexual assault. I think every woman has said to me, if they knew the process was going to be like this, or this is what will be happening, they would never have reported to the police. Next clip, please. And I know and on the flip side, I know some really good examples where, you know, people have had an okay time, they've been treated with respect, they've been believed, things have been explained to them, they've had control, they've had options. And I think even then, when the result doesn't go their way, you know that's something they can cope with. And if nothing else, this is a message I want to leave you with. That one of the really key themes that came out from Sarah Harper's study was that actually the end result, whilst the end result is important, the process is the most important thing. And I think this is a really positive thing for the Victims and Witness Task Force and the work that we're going to be doing forward. If we get this right, if we offer trust, control, choice, collaboration, safety throughout the process, that's going to have a huge impact for victims and witnesses. Next slide, please. So I think I'm going to finish just about here without going into too much detail, just to tell you what the plans are going forward. I'm doing some work with the Victims and Witnesses Task Force to work out a knowledge and skills framework for everybody working in the justice system. And the key aims of that is to work out what do we need to do, particularly for people working in justice system, to do no harm, to minimise re-traumatisation, to get those key principles in place, to support and don't hinder recovery, to gain, communicate and interpret best evidence with an understanding of the impact of trauma in mind, and also really critically thinking about all of those staff members who are affected directly and indirectly by traumatic experiences. So police officers who are witnessing and being affected by traumatic experiences, and also indirectly hearing about those across the whole justice sector. How do we make sure that we're mitigating that? Because we can't pour from an empty cup. I'm really aware that I'm running out of time, so I'm not going to use any of the other slides, but anybody can approach me and ask me a bit more about what we're intending to do there. What I want to say is we're not replacing the full recovery-related knowledge and skills framework. We're just adding to that for a justice framework in terms of what do we need to know given the particular elements in justice that Kate has talked about that are particularly difficult for victims and witnesses. So I think I'll finish there. Thank you.